All right, welcome to The Explainer. Today, we're diving into something that can build up, totally silent, for decades, and then, boom, it turns into a life or death emergency in just minutes. We're talking about coronary artery disease.
Okay, so to really get a handle on this, I want you to picture the arteries in your heart. Think of them like the pipes in your house. They're the fuel line, right? They're supposed to deliver a constant supply of oxygen-rich blood. But what happens when those pipes, year after year, just slowly start to clog up?
You know, the story of a heart attack almost never starts with a big, sudden event. That's actually the final chapter. The real story begins with this long, slow process. We call it coronary artery disease, or CAD for short. And this, right here, is the root of the problem, the slow clog itself.
So what exactly is CAD? Well, it's the official medical term for that gradual clogging we've been talking about. Over time, all this stuff, fatty deposits, cholesterol, you name it, it builds up into this gunk called plaque. And this plaque is what slowly narrows those arteries, which means less and less blood can get through to the heart.
Now, this clogging process, it definitely doesn't happen at the same speed for everybody. There are some major risk factors that can really step on the gas. We're talking about things like high cholesterol, especially that bad LDL kind, high blood pressure, diabetes, and of course lifestyle choices like smoking or not being very active. And yeah, your family history plays a huge role in this too.
Okay, so as those arteries get narrower and narrower, your heart muscle might not be getting all the blood it needs, especially when you're, say, climbing stairs or running for a bus. And when that happens, the heart, it sends out a distress signal, a warning sign. And that warning sign is a kind of chest discomfort we call angina.
Yeah, this discomfort, people often describe it as a pressure or a squeezing, maybe a fullness in the chest. This is the classic symptom of underlying CAD. It's literally the heart's way of screaming, hey, I'm not getting enough oxygen down here. But, and this is super important, not all angina is created equal.
And this is the distinction you have to know: stable versus unstable angina. Stable angina is predictable. It's the kind that shows up when you exert yourself, and thankfully it goes away when you rest. But unstable angina, that's a whole different ballgame. That's a major alarm bell. It means something has changed all of a sudden. It's more frequent, it's more intense, or maybe it's happening even when you're just sitting on the couch. This signals a really dangerous shift, and it's a true medical emergency, no question.
So how do we get from this slow clog to a sudden crisis? Well, sometimes one of those plaques can just rupture. It breaks open. The body, trying to do the right thing, rushes in to form a blood clot to heal it. But that clot can end up causing a severe or even a complete blockage. And that's the moment we cross the line. We go from chronic CAD to an emergency situation we call acute coronary syndrome.
Acute coronary syndrome, or ACS, is the red alert, the emergency phase. It's that exact moment when the slow clog becomes a sudden catastrophic blockage. Blood flow is either drastically reduced or just cut off completely, and the heart muscle, starved of oxygen, starts to die. This is what we all know as a heart attack.
Okay, this is actually pretty fascinating. In the ER, doctors use a tool called an electrocardiogram, an ECG, to get an instant snapshot of what's happening. They're looking for very specific patterns in the heart's electrical rhythm. If they see this one major change called an ST segment elevation, it tells them it's a STEMI, a complete blockage, the most severe type of heart attack. Other, less dramatic changes, those point to an NSTEMI, a partial blockage. And why does this matter so much? Because that one little piece of information tells doctors exactly how fast and how aggressively they need to act. It's huge.
All right, so let's say a patient shows up with some chest discomfort. How do doctors play detective? How do they figure out if they're dealing with the chronic, stable condition or that acute, life-threatening crisis?
For the slow clog, the stable CAD, the investigation is really systematic. You start with the basics, right? Vitals, a detailed history, a physical exam. Then you move on to blood tests, and maybe a stress test. That's where they safely push the heart to see how it responds under pressure. But the ultimate gold standard, the test that shows you everything, is a coronary angiography. It's an imaging test that literally lets doctors see the blockages with their own eyes.
And this right here, this is such a critical point, and it illustrates a huge challenge in diagnosis. A person can be walking around with significant plaque buildup, serious underlying disease, and their resting ECG can look perfectly normal, totally fine. And that's exactly why a full workup with things like a stress test is so incredibly important. But in a suspected emergency, the playbook is totally different. It is all about speed. Doctors immediately zero in on the key signs: chest pain, vital signs, and getting that ECG like yesterday. At the same time, they're drawing blood to look for a specific protein called troponin. See, troponin leaks out of heart muscle cells when they're damaged, so if those troponin levels are rising, it's the smoking gun. It confirms a heart attack is in progress.
So once the diagnosis is clear, whether it's the slow clog or the sudden blockage, the action plan, what you actually do about it, splits onto two very different paths.
Okay, for stable CAD, the goal is all about long-term management and prevention. This means big lifestyle changes. We're talking diet, exercise, and definitely quitting smoking. And that's paired with medications, things like aspirin to help prevent clots, nitroglycerin for when symptoms flare up, and statins to lower that bad cholesterol and help keep the existing plaque from getting worse.
Now, what if the meds and lifestyle changes just aren't cutting it, and the symptoms are still bad? Well, that's when doctors can get more hands-on. They can schedule elective procedures like an angioplasty, where they go in with a tiny balloon to open up the artery. Or for more severe cases, they might even do bypass surgery, where they basically build a new detour for the blood to flow around the blockage.
In an acute emergency, though, the immediate response is a well-rehearsed drill. For any suspected heart attack, this is the initial cocktail of treatments they'll give you. The whole goal here is to stabilize the patient, take some of the workload off the heart, relieve the pain, and just get blood flowing better while the team gets ready for the next, more definitive step.
And for a STEMI, remember, that's the complete blockage. The clock is absolutely ticking. Every second counts because heart muscle is literally dying. The universal goal is something called door-to-balloon time. What does that mean? It means from the moment a patient hits the hospital door, the team has a target of just 90 minutes. 90 minutes to get a catheter into that blocked artery and physically open it back up.
Now with an NSTEMI, the partial blockage, the immediate urgency is a little bit different. The first line of attack is usually powerful anti-clotting medication to try and stabilize the situation. Doctors will watch the patient like a hawk, and if their condition starts to get worse, then they'll pull the trigger on those more urgent procedures.
So if you take away just one thing, let it be this clear distinction. Coronary artery disease is the chronic long-term process. It's the slow clog. Acute coronary syndrome, on the other hand, is the emergency event that happens because of it. That's the sudden blockage. One is something you manage over a lifetime, the other is a crisis that requires an immediate, life-saving response.
Honestly, if there's one piece of knowledge to walk away with, it's understanding this key difference. Being able to recognize those warning signs, especially that fork in the road between a predictable, normal-for-you discomfort and a new, worsening, or resting pain, that is absolutely critical. Knowing that difference really can be the key to getting help in time, and that can save a life.
So we've seen how this quiet, chronic problem can just erupt into a full-blown crisis. This whole journey from a slow clog to a sudden blockage is a really powerful reminder that awareness is everything. And it leaves us with one final thought. Now that you know the signs, what's your heart's action plan? Thanks so much for watching.